Good morning and welcome to COVID-19 Talk with local health authorities. With us is from Harris County. We're not in Travis County. From Harris County, Dr. Maria Rivera, and from the City of Houston, Dr. David Persse. Thank you to Kathy Finninger, past president of the Rotary Club of Houston. I'm Stephen Williams, the director of the Houston Health Department. A question that was left over from last week. Sniffer dogs find drugs and now they can detect COVID on sweat samples. This sounds like a great alternative to a nose swab. Any idea if Houston will get some COVID pups?
I've not heard of any plans of it. The one thing about that is that, well, that's true, and I've read that they can detect it. Training those dogs is incredibly expensive and takes a really fairly long time. So I don't see it as a practical solution for any application. I don't know. How do you feel?
No, I agree. I think emotionally it'd be really nice to have a bunch of COVID pups, but unfortunately, practically it wouldn't work.
Of course, I need another dog. Mine is getting old. The new UK variant likely accounts for about 20 to 30% of infection in the country, and the number is growing. This is quoting Dr. Fauci. I know we did have some information on that.
Yeah, so we've looked at our wastewater. We can see, now the wastewater, you got to be very careful trying to interpret the wastewater data, but all we can really say is that the amount of UK variant in it is rising. You can't really take and say what percent of the population. It doesn't work that way. But from our friends at Houston Methodist, as they are sampling and sequencing people who are coming in, again, so I don't remember the exact number, but it's a fairly small percentage, but they report theirs was doubling every 7 days, and that was a couple weeks ago. So it may very well be at 20% right now.
Yep.
Does it matter if AstraZeneca is approved? Do we need it? Or will we have enough with the other vaccine before theirs get the go-ahead?
Yeah, I mean, I think that's the big question. I think we unfortunately had a setback yesterday with the Johnson & Johnson with 15 million doses. The expectation is that with the Pfizer and Moderna that have been purchased, it should be enough, but there's a lot of things that are always out of our control, and this is, last night I think was an example of that.
So there's nothing wrong with having a little extra.
Yep.
Right. What precautions should we take now for necessary international travel?
Well, I think that you need to keep your guard up for a couple of reasons. One is depending on where you're going. So here in the United States, we have a substantial amount of vaccine compared to other nations. So depending on where you're going, they may have no vaccine at all.
Yep.
So I would definitely keep my guard up. And even when you get on the plane here in the United States, you're going to wherever, there are also people on the wherever you're going to, they're going back home. So once you get to the airport, I would make sure that I kept all my precautions in place. That's what I would recommend.
That includes always keeping your mask on?
Absolutely. Double masking. Double masking. All three of us are wearing 2 masks today.
Yep. Testing before and after as well.
Okay. Why are pregnant women more likely to get severely ill with the virus?
So that's something that scientists are still looking into, but it's something that's really common with a lot of respiratory viruses. And when you're pregnant, you tend to be in a little bit more of a pro-inflammatory state. There's a lot of shifts in your blood volume and your heart, and in general with flu and with a lot of respiratory viruses, pregnant women just tend to get sicker. And I don't know if we know exactly why that is, but the numbers are just there, and we've seen the same thing with COVID-19. I don't know if you have any.
Well, the only thing is the clotting.
Yes.
So when you're pregnant, you're prone to clotting, and the COVID-19 illness increases that. So.
Yeah.
The CDC announced a real-world study shows both Pfizer and Moderna were 80% effective and 90% after both. Can you elaborate, please?
Yeah, so so when you look at all we have to go by is the press release, which gave a fair amount of information. Now, I can't calculate to the 90% and the 80%. I don't know how they did the math there. But in fact, with the numbers that they gave, when I did, I found it to be even more effective. But what it showed was that in a real-world setting, and here's an important distinction. When they did the initial studies, they looked at the people who became symptomatic and reached out for help, right? And so in these studies, what they did was they gave the vaccine to folks, and then they had them swab themselves every week, whether they had symptoms or not. So the big difference is in the initial study, it looked at how many people became infected and symptomatic to the point where they needed help. In this study, they found out whether they got infected at all. And so I think that's a real take-home, is that they were and really need to pay attention after 2 doses. Forget the after 1 dose, that confuses people. After 2 doses, it's 90% effective in preventing people from becoming infected, even if they don't develop symptoms. Okay?
Yeah.
Why are all the precautions about kids eating together in school, while in restaurants, people do not have to wear masks? shouldn't we be more concerned about adults passing the virus along?
I mean, I think we definitely are. I think that when kids are in school, it's a controlled setting, and there's things that we can do about that, because we know that eating with others from outside your household definitely increases your risk of COVID-19, especially if not all the adults are vaccinated. And so the recommendation for kids to eat apart because they're from different households definitely holds. And I think we do actually recommend that adults from multiple households don't necessarily gather right now in restaurants, because you're unmasked and you can transmit the virus to each other.
Does that apply to adults from different households who are all vaccinated?
Right now, the CDC is saying that in small groups, if all the adults are vaccinated, then you can actually gather.
Okay. Lots of conversation about the distance recommendation of 3 feet or 6 feet. Unless you can confirm the actual distance between people, this is simply a guess or speculation, not based on actual study, correct?
Yeah, and this is something that Dr. Persse and I have talked a lot about how they get to the 3 feet and the 6 feet. And I think in general, it's, I don't know if it's just if it's truly a guess, but it's expert opinion. And it's really important to note that the 3 feet rule is for schools. It shouldn't be applied elsewhere. And yeah, kind of leave it at that.
So the CDC recommendation came out based on, there were a number of schools, very large schools, which had a lot of in-person teaching, and they couldn't physically do 6 feet. So they think it was about 3 feet apart that the kids were, but they had strict mask wearing and some other things, and so they had very little spread. So that's, that's kind of where it came from. But here's the other thing. They also found that it does not apply to adults, and I think that's really important. Because there's difference in the, kids don't cough as hard. They don't cough as far. They also don't seem to have as much virus in their upper airways to spread. So this does not apply to adults. So we cannot extrapolate it to any other setting other than the classroom.
So we shouldn't be looking for excuses to just let our guard down.
That's right. And even
Exactly.
if you read it, even within it, it makes a distinction between grade school and the older kids. And there's a difference in the recommendations because the older kids spread it more.
And the teachers, too, need to still be 6 feet from
That's
the
right.
students.
Okay. Are the numbers we watch going the correct way? Positivity rate, case rate, cases?
For now in Harris County, yes.
Yeah, locally.
Are we seeing a surge from spring break yet? Or
Not yet.
what's the news on that?
Not yet, but the one caveat is that we are seeing an increase in UK. So our total numbers are coming down, but within that, the UK is growing. So we got to watch and see what happens.
So what's the relevance of the notation about the UK variant?
Well, I think that, so here's the good news. The vaccine works against the UK variant. So just get vaccinated and we won't have to worry about it.
Okay. Thank you for joining us with COVID-19 Talk with local health authorities. We'll be right back. Go for that.
Houston, we have a problem, more like a pandemic, and now it's all of our responsibility to make sure we end it. So this is a declaration, for others may not have a solution. This is Houston, and we must protect the H.
The COVID-19 vaccines can be our chance to get back to our plans, to get back to each other, to life. But it's okay to have questions, like, can the vaccines give you COVID-19? You cannot get COVID-19 from a vaccine. Find the latest information at getvaccineanswers.org.
You've worked hard to protect yourself and your family from the coronavirus by wearing your face masks and gloves. Once you're done with them, don't toss them on the ground or into the street. Place them away in a closed trash bin to help prevent the spread of the virus, as well as to keep our Houston environment clean and safe. These items are important to wear, but after being used, they belong in the trash, not as litter on our streets or in our waterways. Can it?
Welcome back to COVID-19 Talk with local health authorities. We had a question that came in while we were on break, and the question is, Washington, North Carolina, and Florida appear to be experiencing breakthrough cases 14 days after people are fully vaccinated. Is this new or just unreported previously?
Yeah, I think in general, this is something that we're still looking at. As we mentioned in the previous segment, this new real world study that has come out where after 2 doses, it seems like we're definitely more than 90% effective. There's always going to be some breakthrough cases. And I think what we're seeing in some states like Florida, North Carolina, Washington, is that there are surges and increases in cases that are happening in the community at large. A lot of it is being attributed to all the different variants that are circulating. They're a bigger part of the population. So that's one thing that can possibly explain it. And just in general, if the numbers are higher, I think no vaccine, unfortunately, is 100% effective, so we're going to see some breakthrough cases.
Right.
I have a related question. If Pfizer, Moderna, as an example, if I am in the 5% of those who are not protected by the vax, what test can I take to determine this? If I take an antibody test, what type of test should I take, and what should it show? If it shows none or low antibodies, should I get the vaccine by another company? If low, should I get at least 1 or more shots? I think they're trying to get the predictability of whether or not you're in that 5%. What do y'all think about that?
Well, I think that there are tests that will measure your response to the vaccine. What I've not seen is how well they correlate to real-world experience. So that's a very interesting question. And then the second part of the question is, should I come back with low titers? What do I do? And I don't think we have that question answered yet. That'd be an interesting question to pose to somebody like Hotez, Peter Hotez.
Yeah.
Okay. What is the status of our vaccination rates locally?
Yeah, I mean, I think we're still not at the 70% that we would like. We're slowly increasing. We're hoping to get more vaccine in the next couple of weeks. But I think that as quickly as we're getting vaccine, we're getting it out. And the main issue has still been vaccine supply. But I don't know the exact number where we're at right now.
I don't know.
Yeah. I think it was in the 20.
In the 20s.
Yeah, I think we're
Something
pushing
like
20%.
Overall, I mean, when you go to certain geographical areas, that number is lower.
Right.
Yep.
Recently, some countries are being extremely hard hit. Are we in better shape because many more in the U.S. have actually had the virus?
I think we're in better shape because a lot of the people in the U.S. have also been vaccinated, and we have a lot more vaccine than a lot of other countries.
Yep.
Not sure that we know this specifically, but how many vaccines are given here each day?
Yeah, it's a difficult question to answer, and it's a good problem that we have because we now have so many more people or more ways for people to get vaccinated. It's hard to keep track of. Now, the state does know how much comes into the area on a weekly basis because they distribute it, and you may happen to know what that number is. And those that are vaccinating are pretty much keeping up with the weekly supply that comes in. So there's little or none there's none that's being wasted that I know of, and there's very little that may be on a shelf from one week to the next.
Yeah, we don't really know because a lot of this is related to reporting too.
Right.
That's not exact, and there's a lag in that. After you get an appointment, the distribution process is impressive. Now that the pool has expanded to all adults, what is being done to increase the supply of vaccines? You referred to it earlier. I mean, the bottom line is we're really at the mercy of vaccine distribution. There was a slight increase in J&J this week and some in Pfizer, but the expectation is that in a few weeks that we will get significantly more J&J vaccine. And of course, we'll see whether or not AstraZeneca gets approved. I shouldn't answer that one because the next one has my name on it. Director Williams, you said you have to put boots on the ground to get vaccines to everyone. What is your plan? Basically, what I was referring to is that the vaccine uptake in some communities is low. It's not where we want it to be. What I mean by boots on the ground is that we actually have to go into those communities, not only to have vaccine clinics there, but also do some individualized outreach. We, for example, before conducting certain vaccine clinics in communities, will utilize door hangers, or we will engage trusted community voices to help promote vaccine uptake in those communities. I believe that we're going to have to do that a lot more in order to get those numbers up. Are you targeting vaccine distributions by buildings? If so, where and how do we get on the list? I'm not so sure about the buildings.
At some point, we're looking to engage employers.
Yes.
Yeah.
So the answer would be yes, but it's really more employer-based, or as I was talking about earlier, maybe geographically. I know that we have targeted certain housing complexes,
yeah.
as an example.
And we're targeting certain zip codes that are particularly hard hit by COVID as well, or that have low rates of vaccination. But
Absolutely. How long will those FEMA sites be here? Will they continue to get their own supply of vaccine, or do they take them from the allocation for the city and county? The last answer to that is no, that's a separate allocation that comes directly from the feds. My understanding is that it's unknown as to whether or not they're going to continue past the 8 weeks. I know that there's an offer of leaving the staff here, but the question of whether or not we will get additional vaccines directly from the Fed is still up in the air.
Yeah, it doesn't do us a lot of good to have the extra people if we don't have vaccines. So.
yeah.
Yeah, vaccines would be good. And if we're taking that from the state supply, there's no
Doesn't help.
gain there.
Yep.
So we will want both.
Yep.
Underlying conditions have been updated to include substance abuse disorders. How are you dealing with the homeless population and those who are perhaps difficult to locate? Are you going directly to shelters? How willing are they to agree to receive a shot?
Yeah, we're partnering with a lot of organizations that work with the homeless populations. We're going to shelters. And I don't know specifically how willing people are, but I think it's the same as the general population. And we're still,
Yes.
we are seeing kind of 80-20 is kind of what we are throwing around, but a lot of acceptance.
Yes, and I know we have also engaged some of the clinics that actually target homeless individuals. And we've also gone into shelters.
Yeah.
It was announced that 11 million doses of J&J were coming this week. Who decides the allocation? The answer to that is really the state. There is a vaccine advisory panel. I'm a member of that, and we make recommendations to the health commissioner, and he ultimately decides whether or not he will agree with our recommendation. Would receiving a vaccine while having COVID help the illness itself?
So you're not recommended to get vaccinated while you're symptomatic. But what's interesting is that what we're finding, at least anecdotally, is that some of the folks with the long haul symptoms, once they get vaccinated, they're seeing improvement. Now, it's not 100%, but yeah, while you're symptomatic with the illness, don't get vaccinated then.
You know, I read something too about long haulers who actually got the vaccine and saying that some of their symptoms were actually minimized by that.
Yeah.
Yep.
Yeah. And we don't understand, unless you know something, the last area was we clearly don't understand the pathophysiology of why that works.
No, I think just theoretically it's because you develop additional antibodies and perhaps that helps in some way, but I agree they don't know why. But
Because that would suggest that you still have active virus and causing problems, right? So and theoretically you wouldn't be there anymore.
yeah, it's very
Yeah.
strange.
Yeah. But the vaccine isn't a treatment.
No, not acute treatment, no.
No.
It's not an acute treatment. This past week, there was a press conference regarding Take Your Best Shot Challenge. Great teamwork that more should know about. Would you please share details?
So that was the University of Houston?
Yeah, that was the University of Houston. I'll tell you, why don't we just answer that question after the break. Thank you for joining us with COVID-19 Talk with local health authorities, sponsored by the Rotary Club of Houston. We'll be right back.
The COVID-19 vaccines can be our chance to get back to our plans, who we are, what we miss, to get back to each other, to life. But it's okay to have questions, like, how were the vaccines tested? In rigorous clinical trials among adults of diverse backgrounds. Can the vaccines give you COVID-19? You cannot get COVID-19 from a vaccine. Why should I get vaccinated? Protecting yourself also helps protect the people around you. Find the latest information at getvaccineanswers.org.
Shake up your everyday and come explore downtown. From new art installations to family fun, sweat sessions, and movie nights, we're keeping Houston inspired and entertained. Join us. We are downtown.
If you're over 65, a pandemic is no time to take chances with your life. COVID-19 has impacted millions of lives, including many seniors. But we can help prevent the spread of COVID-19 and get back to enjoying our best years. We must continue to mask up and practice social distancing because we're better together. We face a higher risk, so be ready to take your best shot when a vaccine is available. Protect yourself and help prevent the spread of COVID-19.
Let's get back to brunching instead of late-night munching. Before we can safely come together, we need the facts on COVID-19 vaccines. Visit getvaccineanswers.org so you can make an informed decision when vaccines are available to you.
Welcome back to COVID-19 Talk with local health authorities. But before the break, there was a question about Take Your Best Shot Challenge. Actually, Take Your Best Shot was a slogan that we developed promoting vaccine uptake. But a college student over at U of H actually decided to turn it into a challenge amongst university students. U of H, TSU's, I think St. Thomas, and Lone Star College. And so basically they're going to see, they're going to challenge each school to see what school actually makes the best progress in getting students to take the best shot. So, anything else?
No, that was just great. I mean, you know, here's the other thing that's interesting about that, or good about that, is that, you know, I think that we're doing a fairly decent job of getting the elder folks protected through a variety of mechanisms, and so we're seeing this, you know, the new increases in the younger folks. And, you know, you can interpret that any way you want. Bottom line is that here you've got a group of younger folks who are saying, let's get aggressive, let's take care of this, and they're being leaders in that community, and so I just can't applaud them enough. That's great.
I totally agree.
Variants. All right, this is long, so I'll try to get through it really fast. We hear so much about certain variants are prevalent in locations where there does not seem to be a connection with like transmission through travel. This may seem like a strange question, but for non-science buffs, after the virus mutates, must the variant be transmitted person to person, or can they mutate in many locations and end up looking like the same strain, or at least change the spoke protein to resemble, for example, the UK variant?
So that's a complicated question. I'll take a stab at it. So a couple things. So for the most part, yeah, once you have a variant, once you have a mutation that has a survival advantage, then it will spread person to person to person. That's generally the way it goes. But the other part of the question was, can you have, basically it sounded like, can you have the same mutation occur in two places on the globe at the same time? And that has happened. But again, the key to it, the reason that it winds up working, if you will, is it provides the virus a survival advantage. And that's why it propagates itself and spreads. But that's also why we've got some mutations that have got similar mutations, and yet they also have other mutations which are dissimilar. Okay?
Yep, that's exactly.
Testing regular. Citigroup started providing at-home COVID rapid antigen testing kits to the Chicago and New York employees to use 3 times each week so they can prevent the spread. This is innovative, yet does this sound like a program that can stop the spread?
Yeah, so when you look at the studies about testing, the ones that do help decrease transmission are if you're testing really frequently. And so you do have to test multiple times a week. 3 times a week is probably enough to catch it. It definitely depends on the type of test though. Some rapid tests are getting a little bit better, but if you don't have any symptoms, they may not be as good. And so if you're doing 3 times a week PCR testing, then we think that can definitely decrease transmission. But in general, the more you test, and if you're testing really often for screening, that's when it's more effective. If you're only screening once a month, that's definitely not as effective in decreasing transmission.
One other problem with this technique, though, which is, I agree with everything you said, is that the manufacturers are only making, I believe Abbott, for the ID now, they're only making 50 million tests per year. So to do it for 3 times a week in a population of 330 million people, that's not always near enough tests. So.
Regular antibody tests only show if you had COVID. What is the latest on how long they are evident? Last I heard was 6 months.
how long antibodies are present.
Yeah, I think that's the question.
After infection. Yeah.
Yeah, I think, and it seems to depend on people too. Like for some people, it doesn't. They don't have detectable antibodies 6 months after. Some do, and so I think that's something that we're still learning about, and we don't know why some people seem to have longer antibodies than others.
Yeah, but one thing is that this morning Pfizer came out and showed that their vaccine is producing antibodies protection for 6 months. So that just came out this morning.
Vaccines generate antibody and T cell responses. How do you determine T cell response?
Yeah. That's a laboratory test that I'm not familiar with.
Yeah.
Okay. Could a positive antibody test detect a different coronavirus instead of the one we're all focused on?
From what I understand, no, because it's testing specific proteins in this specific coronavirus and SARS-CoV-2. So when they're testing children that are exposed to tons of other coronaviruses, it won't test positive for that specific.
Okay.
For other ones.
I heard a rumor that Baylor just finished a trial on how Pfizer is reacting to variants to see if we need an additional shot. Have you heard anything yet?
I have no results from that.
No results yet. Is there any medication to speed up the return of taste and smell?
No.
Some
I
people,
don't
like
think
we were just
so.
saying, some people seem to
Yeah.
have some improvement after they get vaccinated, but that's all. Now there are studies being done. In fact, I think Baylor is looking at a couple of techniques to help with the taste and smell. I saw that. I don't know there's no results from it yet.
MIT researchers are looking at a new vaccine delivery by inhalation directly into the lungs. That sounds scarier than a shot. What about oral vaccines?
I mean, with the flu shot, there's nasal vaccines, which are not totally orally inhalated, and I don't know that we're necessarily going to go to oral vaccines again. There is the polio vaccine in some countries is given through a liquid form. But yeah, there are other vaccines that are delivered, like the flu shot, through nasal sprays.
Would it ever be feasible to create an annual shot for MNRA and the flu that could be given once a year? We don't really know that
I
yet.
don't think we know that yet.
I heard an immunologist talking about spike proteins, but was lost on cleaved and uncleaved SARS-CoV-2. What does that mean?
Yeah. So I know this much about this, right? But
Well, tell us that, Mike.
the spike protein has subunits, and like with SARS-CoV-1, the original one, which did not spread like this one, is the spike protein needs to cleave. I mean, when it cleaves, when it opens up, that helps it infect the cell. And the original SARS didn't do that. So this SARS-CoV-2 does do that, and that's why it's more infectious. That's the extent of my knowledge on cleaving.
Okay, very quickly. Very confused about why AstraZeneca was approved in some countries for those over 65 only. Are we test subjects for the young?
No.
No, that's not what it.
Loss of smell and taste with no nasal congestion means I have COVID?
It means you need to get tested.
Yep.
Okay. Young people, women, and those who have previously had COVID had more side effects from the vaccine.
It is. So when you look generally, it does seem that the older you get, the fewer side effects you have when they look at the general population, but they don't, again, we don't know why necessarily that is.
The reinfection rate is less than 1%.
Seems
What was
about right.
reported yesterday, yes.
If there's a surge of cases for the unvaccinated population, fewer will be infected, but the damage to the individual will be worse?
Not necessarily, unless the variants that infect those unvaccinated individuals cause more severe infection. So if they do get infected by those that cause more severe infection, yes, but not just by default, just because they're an unvaccinated pocket of the population.
Okay, thank you for joining us with COVID-19 Talk with local health authorities. With us is Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing the city of Houston. Thank you to past President Kathy Fenninger of the Rotary Club of Houston. I'm Stephen Williams, Director of the Houston Health Department. We'll see you next week.